Good evening and welcome to Health Check. This is your weekly live medical show for all matters health. Now, today we are having a very interesting conversation, and that is on breast cancer awareness. And I think this is a problem that has affected millions, both in our country and also globally. But to help us with this conversation, I have Dr. Victor Ngani right here, who will help us in understanding the causes, how to manage it, the support we need to give to those who are, going through a season where they have to deal with breast cancer. But I love this conversation today because also we're in that awareness month. So we will definitely get deep into the topic and also just get to understand how then do we support these individuals and how can we truly, truly be there for them and while giving them the care and support that they need in this season. And of course, you can also engage with us. You can ask us any questions that you may have regarding the topic of the day today. And of course, kama uko na family members, uko na marafiki, uko na yote ambayo unajua hii topic ya leo itamfaa, please do share the link. We are live on Facebook and also on YouTube, as that is on Hope TV Kenya. And you can also engage us through our WhatsApp number, through sending in your questions or your comments. Tell us where you're watching us from, and that is on 0708222323. Our SMS line is also open, and that is 20933. So karibuni sana and welcome, Victor Ngani.
Thank you. It's my pleasure.
How are you doing?
Quite fine, actually. By God's grace.
Yeah.
I'm happy to be here.
Yes.
Incidentally, my very first time. Which
Oh.
is,
Okay. And I'm glad we're in the theme. People
Yes.
can notice. I have my ribbon, you have your tie.
Your ribbon is pretty.
Oh, thank you. Okay. And, when we talk about breast cancer and even looking deep into the theme of this particular year that we are in right now, in this month, basically, we get to understand that the theme is on Thrive 365. And what I get to understand is that we need not look at cancer as an insurmountable mountain, something we can't get over, but to know that once we give the support and the care that's needed, then we can definitely, get higher when it comes to this challenge. So what are your views, or rather your opinion, on the theme of this year, and what do we need to do as Kenyans?
Beatrice, you've got it right. And I was looking at statistics around cancer sometime last year, and what struck me, and if I focus on breast cancer, for example, is that the outcomes in Kenya are terrible.
Yeah.
I'll give the example of the last set of data we have for 2020, where 6,799 mothers had breast cancer, or diagnosed breast cancer, and about 3,100 of those, die every year. So it means that for the number we are diagnosing, almost 50% are passing away with breast cancer. And then if you compare that to the West, the survival rate is quite high. Less than 20% are not making it. It's because there's room to advance in cancer care so much, you'll not even know. Nowadays, people who have breast cancer stage 4, and we'll discuss stages much later, are living 5 in 20 years. And stage 4 is the type of cancer that we see has spread very far. And therefore, it's quite appropriate to know that you can actually thrive despite being, diagnosed with cancer. It's better you don't have it, but when you do, it doesn't mean it's a death sentence. It's a very good conversation. And actually, I applaud you for choosing this topic. I think the first step towards ensuring we thrive is to get the information out there.
Yeah.
Shows like this don't get the greatest traction, but hopefully over time people begin to understand. It's one of the most important things we could listen to, but we are not yet there, where we begin to understand how important this conversation is. I see it's improving quite a bit, and I hope this will be just one extra, effort to push the knowledge out there so that people can begin to understand why this is super important to us.
Yes. And you've mentioned something very important. We need to create the awareness and educate people so that we can know how to go around it. And maybe whoever is watching us, even in the theme of just being aware, how do we tell from a breast that has cancer and one that doesn't?
Okay. So a number of things that we'll need to do. It's basically screening. And perhaps I should take it from far back and just talk about cancer in general. Then a little bit about breast cancer. Then we can talk about what kind of cancer, what kind of breast might have cancer. So what is cancer? Cancer is actually a group of illnesses. There's no one disease called cancer.
Okay.
It's quite a number of diseases, and your body has more than 30 trillion cells, and these cells keep dividing. For example, if God is gracious, you'll probably live to 90, 100 years. But then the cells in your body live much less than that. Their lifespan is much less than that. For example, your red blood cells, you only live for 3 months. You have to keep replacing them, replenishing them, so that they're fresh every day. So this process of generating new cells, it's perfectly controlled. Your body is amazing. So you have, it has certain signals to replicate, to grow, then to stop. And then grow only up to this area, because you want your nose to be precisely where it is. So the nose cells will grow up to that level.
Yeah.
So cancer cells lose that normal control. The signal that tells them to stop growing, they don't listen to that anymore. So they keep growing out of control. And the confines that tells them don't grow beyond this boundary, they actually disregard that and grow beyond that boundary. So then you have these cells that are continuously growing and then going into tissues that they're not supposed to be. And that is what cancer is. And so the cancer will get its name depending on the type of cell that's affected and then which part of the body it is.
Yeah.
In breast cancer, then you're talking about this kind of abnormal growth of cells in the breast itself. And the breast has many tissues. There is the fatty tissue. Then can we say the glands that produce milk? Then when the milk is produced, huko ndani, it has to come out through some tubing. Those are the ducts. And the cancer generally starts either at the glands themselves or in the duct, the piping system. So if it's from the glands, we talk about lobular cancer. If it's from the ducts, we talk about ductal cancer. So these are generally, and depending on the period of time it takes, then they'll be at different stages. And you may find that it's either very small or very big, depending on the type of cancer and also how far it has been.
Oh.
So having a bit of understanding about breast cancer, then you can answer the question that you asked. How do you know that a breast has is cancerous? 80% of all cancers diagnosed actually come from someone examining the breast by themselves. It's called a breast self-examination. And it has saved many people tremendous pain, because one common thing about cancers, if you pick it up early, the treatments tend to be almost curative. And later on, we'll talk about different types of surgeries. You'll see what I mean by that. And so we've understood the cornerstone is for you to look at your breast and tell us that you think something is not right. Then the doctors then pick it up from there and tell you whether there's something right about or not. There are a couple of stages. The first, just look at your breast. In front of the mirror, you put your hands on your waist and stand in front of a mirror that you're able to see both breasts, and you just inspect. Number one, do they look the same? Do they look normal? And for this particular examination, we recommend that you do it every month around the same time. The best time is about a week after your menses, because that time the breast is not very tender and it's not as dense. There are some changes with hormones. So about a week after your menses tends to be the best time. And then you check your breast every single month. If you do this over a period of time, you'll be able to tell that your breasts look different. It doesn't look the way it normally is. And that's the first thing you're looking for. Does it look the way they normally look when you inspect them? Then secondly, you'll then look to see if one breast is probably higher or lower. Is there any dimpling on the skin? Is there any area that is red? Is there any, the nipple itself, is it getting retracted? Is there some form of crusting? So I'm mentioning a couple of important symptoms where you may have one breast looks like it's not moving as much as it could when you're doing some, either raising your hands, or the skin looks like it's crusty or red, or is dimpling, something we call a pod orange, like the skin of an orange. You're having some dimpling there, or the nipple itself is getting inverted, or it's just doesn't look normal. Then you can then do what we call, you look for lumps. There's a technique. The technique you can find it on YouTube. It's very easy and quite important. And you may feel there's a lump somewhere in the breast. The lump is unusual. It's not something you've seen before. And that's probably that's the most common finding when you're examining the breast. Then finally, you probably have to check if there's a form of discharge from the nipple. I'm just highlighting the most important ones. There are many other signs and symptoms you may find, but those are the most important ones you can pick by self-examination.
And you've mentioned something on the discharge. what kind of discharge will determine that maybe there's a problem? Maybe,
so, any type of discharge from the nipple, unless you are lactating, lactating means you're breastfeeding.
Yeah.
So if you're not breastfeeding and then you find there's a nipple discharge, okay, sometimes you may find it's bloody, it's a fluid, just sometimes just straw-colored fluid, but any kind of nipple discharge that is not, you're not expecting, please see your doctor.
Okay.
Remember, this is screening.
Yeah.
And it's important to qualify. You may find something abnormal, shouldn't be worried. More than 80% of abnormal things you find in the breast, including lumps, are not cancer. So this inspection just allows us to catch a few of those. Less than 20% would be of worry, but it's important to pick. You don't know which one of this is going to be worrisome or not. Let the doctors examine it. Yeah.
Okay. And do we have different kinds of breast cancer?
Yes, we do.
Okay.
I mentioned them briefly, but they are a little bit more than the two I spoke about. So in terms of type, it will depend on the cells of origin. Remember I said that these glands that produce milk. So if the cancer starts from there, we talk about it. You talk about lobular cancer. If it starts from the tubes, you talk about what do you call it? Ductal cancer. And then these cancers can be invasive, meaning that it's spreading into the tissues from where it started, or it's non-invasive. So if it's invasive, then it's definitely moving into the spaces. You can call it invasive. We have different something like inflammatory cancer, but most of these are actually quite rare, and they are not as important for the lay person to understand. There's actually 18 different types of breast cancer. It's not important to know which one is which. If you get a lump, any abnormality, let your doctors pick it up, and then they determine what it is that should be done for you at that level.
Oh, okay. And maybe when we look at now the stages, because I think depending on when you caught it, it depends, we can have different treatments that are associated with whatever stage that it is caught.
Yes.
So maybe you can just demystify the various stages and how the treatment looks like for each one.
Okay. So there are two types of stages. And so you may hear people talking about TNM staging, and then we talk about stage 1, stage 2, stage 3, stage 4. I think most people know about stage 0 to 4, which is, I'll explain that. But I'll also touch a little bit on the TNM. So TNM is an acronym looking at the tumor. The tumor is cancer itself. Any abnormal growth is called a tumor, any sort of swelling. Growth is called a tumor. So first is the size. How big is it?
Yeah.
And that's what we call T. So then T, you'll have T1, T2, and other sort of subscripts for it. Then N is the nodes, the lymph nodes. As the cancer moves to the nodes, how many lymph nodes are affected? So that becomes the N there, and depending on the higher the value, of course, the worse the worse the cancer is. When you talk about M is metastasis. How far it has moved from where it was.
Okay.
So that may sound complex, don't worry too much about it.
Yeah.
The simpler one that you want to remember is the stages. So stage 0 is an area where the cells are abnormal. They've changed shape and they look like they are precancerous or becoming cancerous, but they're actually within very localized. And this is what we call carcinoma in situ, and this is actually very early on, and just a simple resection can actually deal with it, and it's just completely gone.
Okay.
Then stage 1, there's a bit of overlap in terms of staging of breast cancer, because we'll talk about the size, but then if the size is slightly bigger but it hasn't spread, then we lower the stage a little bit, and then you'll find the stage 2A, 2B, 3A, 3B, 3C. I'll not talk about the different numbers, just to know that in general, stage 1 means that the tumor is fairly small, and it's exactly where it started, maybe about 2 centimeters sometimes. Then stage 2 is slightly bigger than that, up to about 5 centimeters in size. And you may have a little bit of involvement in the tumor of the nodes, the lymph nodes, the nodes that drain the breast. And you may find that a few of them are affected. Then stage 3 generally means that the tumor has moved from the breast only and has now gone to the underlying muscles, the muscles under the chest wall. So you can see as the stages are going up, then the tumor is becoming bigger and moving into the tissues.
Yeah.
And then stage 4 would mean that the tumor has spread beyond the area beyond the chest wall is going to far off places. It's going to be the lungs, it's going to the liver or the brain or some far off place. That is what is called distant metastasis. So depending, the stage is just one of the determinants of what kind of treatment you're going to get. There are other factors. In breast cancer, hormones play a very big role. And there are 3 types of hormones that are material here because a lot of breast cancers actually have receptors for this, for these hormones, and those hormones stimulate growth in a lot of the patients. So there is something called estrogen, another one called progesterone, and what we call haprotein. Don't worry much about the and that allows us to determine whether the breast cancer can respond to hormonal therapy. So treatment has advanced tremendously, and regardless of the stage, there are many options available. For cancers that are hormone responsive, you can actually give hormonal therapy. That goes a long way in reducing the cancer to a large extent. If you catch the cancer early, surgery is a big part of the treatment because you can actually resect the different kinds of surgeries. You can do what is called lumpectomy, just remove the lump itself. If it's very early, it hasn't gone anywhere, and the lump comes out. You can remove the breast, that's now mastectomy. We can actually be simple meaning just remove the breast itself. Or you can remove the breast plus some lymph nodes, which is a bit more radical. And then you can perhaps even do dissection. You remove some of the lymph nodes where the cancer spread, depending on how far it is. And there are even instances where you can do what is called prophylactic mastectomy, where you are preventing breast cancer because you are at higher risk of getting breast cancer. So you remove the breast also to reduce that risk. That is surgery. The second option is chemotherapy. And I'm going in detail so that the people listening understand that the treatment options are immense and they're numerous.
Right.
Yeah, you actually have chemotherapy, and chemotherapy has become so much advanced and is available in the country and at levels and dosages where what we thought we couldn't deal with in the past, now we can deal with. And there's a lot of hope in that regard. So chemotherapy is basically giving drugs that kill cancer cells. They're very effective. The problem is that they also kill subnormal cells. So we are normally restricted by the dosage you can give. Then there's also radiotherapy. Radiotherapy is using some waves, sort of beam radiation to kill cancer cells. Again, we've gone so far ahead in the country. We now have what we call linear accelerators. And now if you had KU Hospital got a CyberKnife, which is very specific and quite thorough. So Kenya as a country is advanced and the options are many. Even beyond that targeted therapy, the options for cancer therapy are tremendous. And these are just treating the cancer itself. Then there's supportive care, psychosocial counseling, quite a bit. It's a long conversation, maybe a whole day.
Yeah, but also very informative because I think this gives hope to many who are watching and probably have dealt with it but are like, do I really have any options? It's good to know that we have several options. And I think even those watching may be asking themselves, then what causes it? And is there any way we can prevent it from happening?
Yeah. Well, so there is the issue of what causes maybe not so much, but risk factors is probably the question that we need to answer. And there are 2 types of risk factors. The risk factors you can do nothing about. What are these? For example, but then men also get breast cancer.
Oh,
they do. The risk of getting breast cancer as a lady is 1 in 8. Like 1 in 8 women are at risk of getting breast cancer. And the risk in men is 1 in 1,000. That's not zero. It means that for every 10,000 people, like you could see 10 people who have breast cancer in the men. So men also, if you're listening, you should also do the same thing. Do some breast examination periodically. Get checked. So when you talk about the risk factors, gender, female gender, that's a risk factor there, and you can't do that. You can't change that. Even if you went for all these things we're seeing in the West, it won't change. Then the age, as you grow older, your body is less able to make the normal adjustments that it does to cope with changes in even how cells grow. As family history, if members of your family have had cancer before, there is a risk that you could also have cancer. And in particular, there's some genes that if you have, then the risk of getting cancer is a bit higher. Although genetics account for less than 5% of cancer. So don't hear me say this and you think breast cancer is related. No, there's a less than a 5% risk of getting cancer because of genetics. Then there are what we call modifiable risk factors. These are things you 100% can do something about, and these actually contribute a big way in getting breast cancer. So what are these factors? Cigarette smoke. Kindly, it's not useful. In the past, when you're growing up, it was very cool in the movies, but in reality, it's extremely harmful.
Yeah.
It's harmful because it has what are called carcinogens. Carcinogens are things that cause cancer, and you're exposed to these things, and you can then get cancer as a result. So cigarette smoke is one of those things. The other one is alcohol intake. Alcohol is not as dramatic as cigarette smoke, but actually it's well established now that alcohol intake, even in small quantities, contributes to breast cancer. It contributes differently to various types of cancers, but in breast cancer in particular, alcohol intake has something to do with it. Then if you have a sedentary lifestyle, you basically don't move much, you don't have a lot of physical activity, that's a big risk factor, together with its relative obesity, and obesity has to be qualified. It's central obesity. All the ladies from Luya land should not be very worried. It's central around the tummy, so you want to reduce tummy fat, and especially if there's a big change in this.
Yes.
So in addition to that, there is a big risk that has sort of been understated in Kenya, and that is the environmental factors. We do believe that the pesticides are using in our country that have been banned in the West, and they are banned. Why? Because experiments in mice showed, for example, that they cause cancers, a type of adenocarcinoma. That's just a type of cancer, not breast, but it does cause a type of cancer. And a lot of these things that we consume in the in our marketplace or we get access to, a lot of these things actually are dangerous and it's not well established. So our regulation hasn't been very, very good. I do encourage ladies to be very careful about what kinds of things they apply, including makeup. There are makeups in the past that have been shown to be cancerous. Of course, nowadays there is better regulation, and those are few and few in the market, but you never know how lax regulation may be. So things like those you want to avoid as well. Then, of course, standard environmental pollution. When you drive around and you see this big matatu that is producing smoke as if it's a sugar factory, that's an extreme risk to your health. When you go to a river and people are dumping all these industrial waste in those rivers, the rivers go downstream, they water our crops, the residues in the crops, we buy them in the supermarkets and different places and we consume them. So we'll ask ourselves why cancer is going up in general, not just breast. Those are the reasons. And so if we are able to address those, then we'll probably be in a better space.
Wow, amazing. And, I love that you've mentioned some of the things that we can actually do to make sure that we're getting further and further away from getting cancer. And maybe someone is watching and probably they have breast cancer and they're probably even going through treatment. And just for people to get to be on the know, what are some of these things that one who is going through treatment can do to make sure that their well-being is well taken care of? And that is maybe emotionally, physically, mentally. What are some of these things that one undergoing treatment can put in place?
That's quite an important question, and there is no easy answer. I know that a lot of the things that I'm saying with a little bit of animation, although it's important, but for this particular one, it's very hard to do that because, as I mentioned, breast cancer alone right now, when we say 6,000 diagnosed every year, there are 15,000 who are living with it today in the country.
Yeah.
And it means tomorrow, every day, we're diagnosing 18 people with breast cancer, 18. And out of those, we are getting about 8 people are passing away, 8 to 9, but every single day, breast cancer in this country. Globally, there is estimated about 7 million people have breast cancer, living with it. Every year, we are diagnosing 2.3. And every year, about 600,000, 650,000 are passing away from breast cancer. So it sounds quite dire.
Yeah.
But these statistics are very skewed. They're skewed because with best care, what you have in the Scandinavian countries, it's almost, it's probably even harder to talk about something like diabetes than cancer because the diagnosis is made, the treatment is done, and the outcomes are so much better. Unless they tell you, I was diagnosed with cancer 20 years ago, you'll never know. Unless they themselves come and tell you, you'll not even see the sense of it.
Yeah.
And so to anybody out there who has just been diagnosed with breast cancer, take heart. Kenya is doing amazing in cancer therapy. If I look back at what we're doing in terms of treatment, just 3 or 5 years ago, and what you're doing now is like night and day. We already have 2 PET scans, and in fact, our own facility, we are putting up the 3rd PET scan in the region, which is a new branch, RFH Specialist Hospital. And the KU has already put a CyberKnife in place. The cancer therapy, the treatment modalities for breast cancer, you do not need to go anywhere. You will get everything here within the country. We have a lot of oncologists graduating every single year, and nurses and the whole support team. So there's a lot of hope, and our outcomes are getting better by the day. I'm glad I'm speaking in a Christian station, because then I can say that be anxious about nothing, but in everything come to the Lord in prayer. And that is fundamental in breast cancer and in cancer in general, because the tendency to worry is there. Look, as I've said before, I know you'd rather not have it, but now that it is there, that's the hand you've been dealt. And God has plans to prosper you. Good, you know, and His plans are good and perfect. And sometimes you don't understand it. So, in that space, yes, it's definitely unpleasant. But you may be surprised that after all that worry, you're fine. And therefore, the worry doesn't really, you know, so to be in that space of finding support, getting someone you can talk to, expressing the worry that you have, but also being encouraged by the stories that come out of you know, our current setup, and to know that it's not lost, no matter the stage. Even if today you're told it's stage 4 cancer, it doesn't matter. Give it your best shot. Give it your best. Meet the doctors we have, and just, you know, walk the journey. Worry actually works against, it reduces, you know, your well-being significantly. It makes it harder for your body to cope with the therapies, and even to just grow. So support systems, people around you, a positive, you know, approach to understand there is hope. I know it's, you know, there's lots of fear around it. Get rid of, you know, as a people, society, not the survivors. Society, we deal with stigma. It's there's no reason whatsoever. It makes no sense to have stigma around cancer. It's not contagious. It is, you know, it's an illness now, almost becoming like many other illnesses. Then you'd want to eat well, be healthy. By that I mean fruits, vegetables, everything in moderation. Avoid processed meats. Avoid too much of this, you know, sugary items that are unnecessary. Just exercise. All these things boost your well-being, and I can confidently say in this above all, say a prayer.
That's beautiful. That's very beautiful, and I think we are getting so much enlightened even with that information, for whoever may be going through this process right now, and even for whoever is tasked with the obligation of being a caretaker. I hope you're taking notes. I hope you're understanding all of these things that need to be done. So we'll be taking a very short break, but once we get back, we'll just continue with what we have here as the questions directed to Dr. Victor Ng'ani. But of course, you can also send in your questions and your comments on our WhatsApp number, which is 0708 222 323. We'll be back shortly.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better, and I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better. Sindio?
Huh? What time is it? I need to catch up on Leadership Forum. Did they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcast?
Really? Even Meet of the One?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
So Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
In order to keep hope alive in the airwaves, Hope Media has a couple of initiatives. Friends of Hope. Friends of Hope is you and I forming a team of well-wishers and volunteers who give in cash and kind to support in spreading the gospel at Hope Media. Currently, Hope Media is running a campaign under Friends of Hope dubbed 100 for 1. Through the campaign, Hope Media is asking Hope FM and Hope TV listeners and viewers to give just 100 shillings in order to reach one more soul with the message of hope and the gospel. Engage with us on our social media platforms at Hope FM Live and at Hope TV Kenya. Kuwa rafiki mso leo.
Welcome back. This is Health Check. My name is Beatrice Watari, and we are having an amazing conversation on breast cancer awareness with Dr. Victor Ngani. And guys, I just want to let you know about our campaign that we're running currently called FOH, hashtag Rafiki Mso. How you get to be a Rafiki Mso, in other words, a friend of hope. You can join in the campaign that we're running called 100 for 1 by contributing 100 shillings or more for one soul. So 100 bob is for one soul. If you contribute more, it means that we can reach more people with this type of programs, with the message of Christ, with the message of the gospel. So be part of it. And you can send in your contributions on our paybill number, which is 933933. Account, you can write there FOH. So come through and be a part of this big family that we are having, and also support us even in running this campaign. So Dr. Victor, I see there's some questions that are coming in from people who are viewing. Thank you so much, each and every person who is tuned in. You can send in a comment, let us know you're watching and what you're also learning. So one person here has asked, hi Beatrice, please ask Dr. Victor, why is cancer treatment so expensive? Is there hope that it can be affordable? This is Vicky from Kikuyu.
Hi Vicky, that's a fantastic question. And Kenya has generally struggled with accessibility of healthcare. But one area where NHIF, the former NHIF, has done amazing in is making cancer accessible.
Okay.
And at this juncture, I do encourage everybody to enroll. Okay, now it's going to be mandatory, but in the past, it was a voluntary scheme. NHIF has done amazing, so that it was paying, I believe, 25,000 per session of chemotherapy. They'd pay up to 80,000 for radiotherapy, and they'd pay for surgery. And so even the PET scan that people are doing now, people used to go to South Africa and India for it. You had to be rich, multimillionaire to do this. And now, in fact, my uncle has just gone to KU today to have a repeat PET scan after being treated. The first one was clean.
Yeah.
So these are accessible things now. You don't need to worry about the cost of cancer. And if I understand perfectly well what President Ruto is trying to do with, let's call it Ruto Care, I think there's hope. If the money that's collected goes to healthcare, it will get even better. So let us not be completely phased by the costs. Yes, they are still expensive, but especially if you opt for a little bit more than what is provided within the NHF packages. But this hope is going to get a lot better. Why is it very expensive? The treatments themselves are coming to Kenya, at very high costs. So I hope they'll get better. The machines are super expensive.
Yeah.
The setting up the kinds of there's some radioactive water is supposed to set up a cyclotron. That whole system is almost 1 billion shillings. And getting a PET scan, all these things, these are hundreds of millions of shillings that people are putting up. Hopefully, we'll get cheaper options in the country.
Yeah.
But for now, our best hope is to have government support families in need of care.
Oh, okay. And I see another question here. One is saying, thanks for the show, Hope. But why do they cut breast in some patients and others they don't? And some succumb to the disease even after losing the breast.
Yeah. So a couple of things. It depends on the stage.
Okay.
So if the stage is a little bit advanced, and I'll give this example. If you find that the cancer has spread beyond the breast itself, then even if you remove the breast, you see the cancer is still there. And so before we do the surgery, we try and assess has the cancer spread beyond a point where removing the breast doesn't work. And sometimes you get it perfectly well. Sometimes because cancer cells are microscopic, you may actually get a few lymph nodes, and the lymph nodes you take are clean, but there's a third lymph node somewhere that's hiding that has a bit of cancer, and you will not know that until much later. So a lot of these treatment options depend a lot on the stage.
Okay.
So whereas one person may get, in fact, not the whole breast, just a lump being removed, lumpectomy, and that's curative. Another person may actually have both breasts removed, but the cancer has gone so far that even that is not enough. So it depends on a lot of things. But also remember that the treatment options for breast cancer are many.
Yeah.
So don't look at the surgery, that's just one. It varies from patient to patient, and discuss with the doctor, then they'll advise you. Yes.
Okay. And maybe looking at our country right now, what are some of the support systems that are in place for people who maybe have breast cancer and even the survivors? Do we have any, and what do they look like?
Kenya Cancer Association has done an amazing job. I think they have a support group. I know they have a support group for breast cancer survivors, and they do take part in a lot of shows and a lot of programs that are doing breast cancer screening. I know Catherine would not mind if I mention her name on air, but she's literally trained so many healthcare workers and so many people on breast cancer awareness issues. As I mentioned, it's just that we, the people of Kenya, would want to watch a lot of TikTok. But a show like this that is quite useful, we don't pay much attention because we're generally very young. And we become old insidiously. We don't even realize we're old.
Yeah.
I didn't think I was old until my daughter told me I was old. So we do not realize that we need to consume this information. So if you're watching, by the way, there's a very good chance that your neighbor is not watching. I'm certain of it. And they'll probably never watch. So take it upon yourself to pass this message to them. Yeah, I hope that covers that question.
Yeah. So we definitely have support systems, and I think what is lacking is awareness, and not just awareness about breast cancer, but even about what is being done by the country currently to make sure that there's support being given. And I think we also need to talk about it. So thank you so much for addressing that. And I think it gives us a lot of hope to know that we are not alone in this battle. I mean, this is something that is being faced everywhere, all over the world. And Kenya right now is advancing in its ways of making sure it's giving the correct treatment, and all these therapies are being done. So I believe that we need awareness, not just for the breast cancer, but also of the support systems that are in place, and so that people can seek help, those that need help.
Now, I think the Kenya Cancer Association, their acronym is KenCasa.
Yeah.
You can look it up on the net. And actually, if you know someone who has breast cancer, then you can go ahead and reach out, and I know they're normally willing to support and assist.
Yeah.
Yes, thank you.
And maybe now we can talk about the caregivers, or the people now who are faced with the responsibility of looking after someone who has breast cancer. What are some of the tips that we can give them to make sure that they're doing it the right way?
So the main thing is to do your best to understand that this is not necessarily a fatal disease.
Yeah.
And there's a lot of it sounds like a pun. There's a lot of hope when it comes to cancer matters now.
Yeah.
There's tremendous opportunities, and actually cure more and more cancers, even at later and later stages. The objective of treatment is increasingly cure. We are looking to completely eradicate the cancer. Okay, we never speak about 100%, we talk about survivorship. So we're talking about 5 years survival, 10 years survival, 15 years survival. And that's the objective for many, many of the cases that we have. So that state of mind, that attitude towards cancer generally changes how we approach the situation. So that's the first thing. The second thing is just to promote healthy habits, things that encourage a strong body that's able to fight disease and take therapy and take what can I say? The chemotherapy is not the best, and the therapy is not the best for the period of time you're having it. They may have some side effects. You may feel like you want to vomit, and so getting the body ready to deal with this is quite useful. Be the source of positivity for the patient, because they are in a state of worry and anxiety, and we shouldn't amplify that. Instead, should be the calming effect, and that's probably the most significant care you can give.
Yeah.
Generally, breast cancer patients, unless it's very advanced, tend to be self-sufficient and self-reliant. They're able to take care of themselves day to day. They need a lot of help in terms of areas where cost may be an issue, maybe moving from place to place, psychological support, friendship. There's a lot of introspection at such a time. So that kind of support is needed. But by and large, we tend to have people who are independent, are very productive in society despite the diagnosis. And so to recognize that and support them in this way is what is called for.
And maybe I think we can give a word of encouragement, and maybe you can speak to someone who is probably going through, the whole condition of breast cancer, and maybe they feel like all hope is lost. Maybe from your own view of the survival rates and what you've been able to see, maybe you can speak a word of encouragement to that person.
The truth is that we have had the single biggest reason why we may still have some pretty unpleasant outcomes is because we haven't passed the message out early enough, and so we still have a lot of late diagnosis.
Yeah.
And that becomes a problem. But if your cancer has been diagnosed early and categorized into two, the chances that you will be talking to your grandchildren for the next 5-10 years is very high. That's where we are, because that's where the West has been. And if the West can do it, the Africans can.
Yeah.
And there's a lot of progress. And I believe this progress will continue year on year. Where we are in 2022 2023 is way better than where we were in 2020. And next year is going to be better still.
Yeah.
Because of some of the initiatives that are being done, including in one facility, the kinds of setups you're putting up are amazing. So have hope in this way. And even when you have come late, by circumstances have happened in a way that the diagnosis has been made late, then there is still hope. It's not done until it's done, because work with your doctors. And I do realize that even as I'm saying this, there are cases that are so far advanced that despite the best care we can give as healthcare workers, our situation is not good. And in this space, just remind us that all of us are it's a journey. There's still a lot we can do to improve the quality of life, to make sure that there is no pain or as limited pain as possible, and to give someone quality time to spend with family, and even just in prayer and just a reflection over one's life, because life doesn't end, there's still life after this, where the cancer doesn't matter. So to take courage and know that God is in control, even in that situation where the doctors actually tell you this is the 10% cases that we feel we may not be able to do much about, and those do exist, and I know that those are going through that right now. Our sympathies are with you, but we also know that beyond doctors, there's someone else who's greater than the doctors. So being in that space, to give thanks to the Lord and just ask for His good and perfect will to play out. We never understand it fully. We are human, but in fullness of time, it will become clear that God doesn't make mistakes.
Wow, amazing. And maybe at this juncture, time is not on our side, but I've really, enjoyed this conversation, and I think I'm getting so much. But maybe just to wind up, maybe you can give a final remark. Just, that last thing you want to say on this topic. And also in combination to that, you can let our viewers know where they can find you, where you do work, and just how they can get in contact with you in case they have more questions.
Beatrice, our biggest problem is that we don't care enough about cancer unless we ourselves or the people around us have cancer. And we need to change that. So anybody listen to this should pass this message across to as many people as possible.
Yes.
Because the things that you can change, that you've not changed, if you got cancer today that was as a result of something modifiable, there are those that are not modifiable. Those are things that happened 10, 15, 20 years ago when you're still young and healthy.
Yeah.
There are things, if you are smoking, you're smoking for 10, 15, 20 years before it became an issue. You're drinking excessively for 10, 15, 20 years. People need to hear these kinds of conversations. I don't think people pay much attention because it's not it's not funny, but it's more important.
Yeah.
And it's more important for those who have time to change.
Yes.
Because if I meet you when you're 60, you've been smoking for 30 years, it's not as useful at that moment, though you should still stop, as when you are 30 years younger, because then there is room to really change a lot of things.
Yeah.
So I do pray that people will begin to listen. That's the most important one. Let us take advantage of these cancer screenings. This is October. There have been cancer, discounts everywhere, screening everywhere. Take advantage of those screens. Get your health checked once in a year.
Yeah.
We have packages in our own facility, RFH Healthcare. The packages are amazing. You can have, your liver checked, kidneys checked. You have prostate if you are for the men, breast checks, ultrasounds, all forms of checkups for between 4,000 and 10,000. This, and these are some things you do like once every 2 years,
Yeah.
for less than your Netflix subscription in a year. So let's get into that habit of getting informed and getting checked.
Yeah.
For your second question, I'm the Chief Medical Officer for RFH Healthcare. RFH is a group of facilities now. We opened our 10th branch on Kiambu Road. And what we try and do is just make sure that we literally give care as good as Kenya can.
Yeah.
And affordably. And we're actually putting up a cancer center. This I knew you know this when you invited me, but
Yes.
we are putting up a cancer center to be up and running by January, God willing, and we'll put the third PET scan in this region. We used to go to India and South Africa for this, and a few other therapies. So someone asked about the cost of cancer care. I think when our center is up and running, we'll actually have tremendous relief for many people as well. Yes.
Wow.
To reach us, rfhealthcare.co.ke. Look us up, and
Yeah.
please join us in case you have a question or any healthcare need.
All right. And your personal
Uh,
socials?
At OVNGANI, Ovingani. You can look me up, Dr. Victor Ngani, on the net, and probably you'll find my socials. I have a website. I don't know whether I've updated it. VictorNgani.com without the apostrophe. Yes.
All right.
Yeah.
Wow. This has been a beautiful conversation. I think I've gotten so much. I've gotten to learn so much. And I think the beauty of it is that whoever is watching, even if you don't have the cancer or don't even know anyone who has the cancer, there's just some of these little things that you can do to make sure you're keeping healthy, eating right, exercising, watching, what you're eating, especially those who, indulge in alcohol and smoking. That's a no goes on, because again, we have to reduce those risk factors. But thank you so much, Dr. Victor. That has been very insightful. And I know many people out there have gotten to learn. A lot of hope is being extended also to anyone who is suffering from breast cancer, and maybe they feel like all hope is lost. Definitely there is hope. Prayer should be your first resort. Keep praying, ask God for that strength, and know that there's a beautiful story being created, because God has a way of working everything for the good, even those things that we feel are not very pleasurable to us. So thank you so much for tuning in tonight. Thank you so much also for those who shared the link. Please do share the link even after this episode to anyone you feel will need this information. Dr. Victor has mentioned that the biggest problem we have is that we don't have enough awareness, and most people do not tune in to watch programs like this. But if you were able to watch today, then do share that link with someone who needs it. So that's it for us right here at Health Check. My name is Beatrice Watare. Do have a good night.